My oars of curiosity propel forward my boat of knowledge. On the river of wisdom, towards the horizon of enlightenment. The energy of this universe is devotion. Devotion to my guru, my teacher. Devotion to the quest. Devotion to the unreachable horizon. I may never arrive, yet I forever move forward. For the loftiest goal is the journey itself.
When we hear the word museum, usually the picture that comes to the mind is that of a desolate place where antique items are stored for demonstration. But this is not the case with MS Ramaiah Museum, what you are seeing, where right from the time of conceptualization, this was a place which was meant to be an innovative platform for extensive learning by using different techniques. So in this context, the museum is a place where we have the regular routine specimens and models, but more importantly, an interactive system for people to touch, feel, learn, experience and imbibe.
We have these various regions. You can click onto any one of them. Can anybody come forward? And okay.
You can basically select any one of these to see the anatomy or the action. The posterior view of how the muscles act, you can see all that. And you can also choose actions of other muscles, for example, mandible retraction. Mandible retraction also from the lateral view, how the temporalis contracts so that the mandible goes up. You can see from inferior view also.
Information and technology has changed our pattern of learning. We welcome you to the topic of the month, dengue fever.
Module 1, History and Epidemiology. What is dengue? Dengue is the most common arthropod-borne viral or arboviral illness in humans.
Epidemiology of dengue. The transmission of dengue virus depends upon 1. Biotic factors, that is the virus, the vector and the host. And 2. Abiotic factors, which are temperature, humidity and rainfall.
Transmitted by mosquitoes, dengue fever is a threat to almost half of the world's population. Dengue is a major public health problem, particularly in Latin America and Asia, where outbreaks occur regularly. When biting a person through its blood meal, an infected mosquito releases saliva containing the dengue virus. Once in the body, the virus infects the immune cells in the skin tissue.
Regarding pathogenesis, this slide which gives you an outline of the entire process. The virus enters the reticuloendothelial system and the bone marrow.
I'm just trying to see the basis of what you have learned so that I'll be able to guide you as to how to take it in future. Okay? So, I'll make it easy for you. Do you understand that when you are going to treat the patient, You are going to treat the patient as a whole. Did you get that understanding? You have heard of a lot of specialities. You have heard of cardiology, you have heard of gastroenterology. Did you realize that they are focusing on a particular system? Okay. But when you treat a patient, still you have to treat the patient as a whole. You can't dissect a knife. You get that? Did you understand?
I'm standing and appreciating the real-life models of the cranial cavity and the brain in the interactive museum situated in the first floor of MS Ramai Medical College. These real-life specimens have assisted me in appreciating the intricate details of the mysterious human body, and I'm pretty excited about returning to this museum every day and seeing the various theory and practical aspects for myself, so that it helps me recollect faster and better during my exams.
It's very difficult to study anatomy without seeing the specimens in real life. It's such an important subject. It's the basis for the other years. So unless you read anatomy without seeing the structures, it's very difficult to correlate parts. And we have fetal anatomy as well, where we can see the embryological models. Head and neck specimens especially, they are very nicely built, because head and neck is such a part where all the structures are very minute. It's very difficult to observe them in the dissection hall.
By using formalin, and we all know the side effects of formalin. Sometimes it irritates our eyes, nasal mucosa, right? And skin also becomes. So there is a special method called as plastination, where these are all plastinated models that you're seeing here. You can have it. These are all dry, odorless, non-irritant, non-toxic, isn't it? So formalin, we have so much of irritations. These are all called as plastinated models, okay, where we get a dry, durable, you can hold it easily, okay, you can see this specimen. And this is also the tracheobronchial tree, you can touch it and see, okay, with your bare hands. This is the sheet plastination. There are 3 different types of plastination. This is the whole organ, and this is the luminal cast plastination, and this is the sheet plastination. So this is a method of preservation of the specimen without using the formalin.
The basic purpose of having an integrated museum is so that a student gets a comprehensive learning about the entire subject of pathology, and not only the subject of pathology but all the related aspects, like that is medicine, radiology, even surgery. So this is a center for self-learning and to get a comprehensive idea. That is what we mean by integrated learning. So what we have here in this pathology museum is, we have a large collection of nearly 900 specimens. Now this is a collection which has not been done in a few months or a few years, but it is a collection of specimens gathered over more than 30 years. It's very difficult to get rare lesions in a period of 1 year, but since this is a collection which has been made over 30 years, we have a very good collection of even the rare lesions which a person might not get to see during their entire lifetime. And we have intentionally not put the diagnosis on each jar, because if we put the diagnosis, there will be no thinking on the part of the student. Our basic idea here is, it is not only self-learning but also self-assessment. So when a student comes here, he should try to identify each specimen and jot down the diagnosis and even a short description in his notebook, and then go through the catalog which we have made. So if a student has already made a diagnosis for this entire set of specimens, then he can open the catalog. So this is the catalog that we have, and in this catalog we have given a very detailed description for each specimen. Like, it starts with the diagnosis on top, so the student can match his own diagnosis with the correct diagnosis mentioned in the catalog. Then we have a short clinical history so that the student knows the clinical aspects also, how this particular patient might have presented. Then we have the gross description with a photograph of the same specimen which is here, and also a microscopy so that the student can also recapitulate the microscopic features of this lesion. Now, other than these specimens, another important highlight of our museum is the collection of X-rays. So again, it is an example of integration. So a student will see, for example, a specimen of pneumonia here, and will also see the X-ray appearance of pneumonia. So it's not only pathology but even medicine that the student is learning simultaneously.
Which shows the case of mitral stenosis, CVS2-1, the labeling has been done properly, the gross picture has been put, explanation is there, there are some questions which you can utilize, okay, and to see that whether you have learnt it from or not.
Both of them are fibrocystic diseases of the breast.
B stands for breast specimens. Okay, then from third onwards it's only the tumors. Okay, you can see a beautiful tumor here. You can see those slit-like spaces. Okay, so they are fibroadenomas. Okay, showing nice slit-like spaces. These are all various type of carcinomas.
If you know that the endocrine system, the most commonest pathology is in the thyroid gland. So most of our specimens are from the thyroid gland. Starting from here, it starts from the 2 itself, because there are hardly any congenital anomalies in the thyroid gland. These are the different appearances of the goiters, and goiter is the most commonest pathology that we see in the thyroid gland.
And then here we have a beautiful collection of gallstones. I don't think anybody can imagine that a single person can have so many stones in the gallbladder. You can just see tiny slits looking like a jewelry box. So this is a female who was aged 40 years who had so many stones in the gallbladder, stones ranging from large ones to tiny ones.
This is the section on congenital anomalies. Here we have got very rare specimen, which you may not get to see in your entire lifetime. Okay, we have got specimen of this mermaid limb here. Yeah, this is his mermaid limb. Yeah, there's fusion of both the lower limbs, and we have got specimens, the entire spectrum of neural tube defects, ranging from lumbosacral meningomyelocele up to anencephaly.
We have divided the microbiology section into various sections like general bacteriology, systemic bacteriology, virology, mycology, parasitology, and the biomedical waste management. So we do have various charts. These are the general bacteriology, where we do have the Nobel laureates who have contributed to the various aspects in the microbiology department. So the various artificial media which are used for isolation and identification of the various infectious organisms we do in microbiology. So these are the various models of the viruses, and we do have the catalogs which are available in the museum, so that you can get the detail about each chart as well as the models which are available in the microbiology.
During our exams, we can come to the museum and we can see all the culture media and all those spotters which will come in the examination and all the examination point of view.
So these are all the charts which depict the various clinical conditions and the questionnaires which are asked on these clinical conditions. Is drugs used in tuberculosis and the mechanism of action, then anthelminthic drugs, anti-malarial drugs, then antifungal drugs are all depicted here, the mechanism and the available marketable preparations.
It's always said that the world outside is a better classroom, so instead of the classroom, it's a really good thing that our department has opened up this museum.
I'm proud to introduce Dr. Mrs. Duva Sharma, who is a well-known personality in the field of physiology. She was principal of our institution from 1981 to 85, and she also was heading the department of physiology. And because of her, we have all these instruments belonging to the museum of the department. And I request Madam to speak now.
Thank you, Rupa. It's nice to be here, back home. We are here in the physiology lab, and these are all the instruments which are used for teaching and research, and mostly of neurophysiology. We were just talking in the morning about some of these instruments. These are like stimulators and pulse generators and oscilloscopes and stereotaxic instruments and so on. One thing which I was discussing in the morning, this is about this stereotaxic instrument, which is coordinated oriented, and you can use it for the study of the neurophysiology, like brain of the different animals, like rat, cat, monkey, dog. And all these instruments, it just differs a little, and the same principle is applied for the human beings also.
Welcome to the anatomy section of the Museum of MS Ramai Medical College. The subject of anatomy is the basic foundation science in the field of medicine. It is the pillar of medicine. Our museum was established around the year 1981. An anatomist, Frederick Knox, has told that without museum, the profession of anatomy would be like a state of man without language. The museum has a wide range of collection which is used extensively for medical teaching and training. There are about 700 catalogue specimens and models illustrating normal human anatomy. The museum not only caters to the medicos but also to the allied courses and school students.
Museum is a place where books are written, where books can be written. So the various sections of our museum, including skeletal remains, weapons and firearms, and toxicology section, and soft tissue specimens which depict the common disorders that we encounter at autopsy.
Examining the skeletal remains, you can determine the age of the individual, the sex of the individual when he was alive, right, and the time since death.
When in case of assault, the weapons are one of the important criteria which can help in determining the type of weapon. So the injuries that can be caused by the weapons is an important point for the police officers to investigate. As you can see, you have various types of weapons, the blunt weapon, sharp weapons and firearms. So by looking at the weapon, you should be in a position, or commonly when we get an injured person, by looking at the injury, you should be able to identify the type of weapon what it has been, whether it is a knife or a heavy light cutting sharp weapon like knife, or a heavy sharp cutting weapon like a chopper, and what is the type of weapon that has been, whether it is single-edged or a double-edged. By looking at the shape of the wound, we can determine that.
Kerosene, this is the kerosene exhibit where when they consume kerosene, usually kerosene poisoning is always accidental, right? Some children will be playing in the kitchen, so they don't know. Some people store the kerosene in a Pepsi bottle, so children don't know whether it's a kerosene or a Pepsi, so they drink and accidentally they get poisoned.
This museum is the present and will be the future platform to the field of research and education